Welcome to the new Royal University Hospital Emergency Department, located in the new Jim Pattison's Children's Hospital, JPCH. We're very excited to show you the new emergency department and provide a brief overview in order to make your first visits more comfortable. The new ED features 42 beds, 4 trauma bays, 26 exam beds, which includes 3 high acuity mental health spaces and 12 minor assessment spaces. The Children's Emergency Service will feature a separate 10-bed unit, which will also have 2 high acuity mental health rooms. In the new RUH-ED, the Adult and Children's Emergency Services will exist as 2 separate and distinct departments. Both will have their own staff, triage processes, and physicians. The radio patch system and process will not change. There will still be only one RUH patch channel for both adults and pediatrics. The adult triage staff will be responding to the radio. The patch phone number will not change. The number remains 306-655-1440. A new phone tree has been added on the call line to help guide your call. Select number 1 to speak to adult triage and select number 2 to speak to pediatric triage. The medical control access phone numbers will also not change. Please ensure you are using the proper medical control numbers and not the patch phone line numbers when you are seeking advice from our physicians. Prox cards are being issued to each EMS service. A Prox card is required to gain access to the new RUH-ED and open most doors within the department. It's very important to ensure you always bring your card with you. Star of Life directional signage is posted throughout the department to help guide EMS. Pediatrics will also continue to use the same age guidelines. A pediatric patient is 17 years of age less 1 day and considered an adult on their 17th birthday. The old ambulance bay will be out of service and no longer accessible to vehicles. The new ambulance bay is located just past the old ambulance bay on the right. It features 2 garage door entrances which are triggered by a vehicle driving up to the door. The ambulance bay is located at the rear of the emergency department. Height clearance for both of the bays is 3.8 meters with space for 4 ambulances, 2 on each side. Please note the width of the 2 doors is different. The door on the right is wider than the door on the left. The right door must be used for any of the oversized ambulances, for example PEDS transport and NICU transport units. When entering the garage, please be mindful of the large building support column in the middle. Doors will be opened internally by pushing garage controls at either exit door. If you're going to be delayed in the building, remember to move your ambulance from the bay to the designated parking areas. If you do not have a Prox card, then please use the silver intercom to gain access. On arrival from the ambulance bay, you enter directly into the trauma area. For critical patients, when you enter the ED, there is a small triage desk located immediately to the right. You will be met by a nurse on arrival. Triage registration and room assignments will be completed. Both adult and pediatric patients can be looked after in this space. For stroke or STEMI alerts, you will follow the critical patient pathway as well. On arrival and immediately to your left, there is a large pillar with medical muster point sign located on it. This is where the patient will meet with neurology or cardiology teams. Once the patient is assessed, you'll be directed where to go next. For the cath lab, please use the RUH connector hallway. For CT scans, a CT scanner is now housed directly within the trauma area, approximately 20 feet down the hallway. All non-critical ED patients will be asked to present to the front of the ED where the main triage station is located. This is approximately a 40-second walk, so please make sure you bring any equipment with you that may be needed. Please follow the signs to the paramedic triage registration zone and park your stretcher there. Then send one paramedic to the triage captain location to begin the patient triage process. A registration clerk will come to the patient's side for bedside registration. Please see the standard work documents for further detail. Registration processes will be the same for all non-critical patients' needs, including inpatient transfers for tests, admissions, and consultations. Once the triage process is complete for adults, you will be directed to one of 4 locations: minor assessment and care, active emergency exam rooms, trauma, or the waiting room. For access to inpatient units of the JPCH, PICU, NICU, labor and delivery, please use the elevator located in the central core of the emergency department. These elevators are for JPCH patients only. Please use the RUH connector hallway and RUH elevators for all other patients. Non-critical pediatric patients will travel through the trauma area and turn left into the children's emergency area. Triage and registration will be completed at bedside within the children's emergency area. The most direct access to the RUH connector hallway is located through the trauma area. This connector will come out in the RUH building outside of the OR recovery room area. Please do not take routes which travel through patient care areas. The RUH connector hallway can also be accessed by traveling past the JPCH elevator bank. Once you have completed your tasks in the main RUH buildings, return to the ambulance bay via the RUH connector hallway. Signage is in place to identify the most effective pathway back to the ambulance bay. Maternal Services is located past the JPCH elevator bank and to the left. Ambulance Bay features 4 storage spaces for paramedic equipment, 2 for paramedics outside of Saskatoon and 2 for paramedics from Saskatoon. The cages will be where used equipment is stored. The closets will be for storage of pertinent equipment. All spaces will have coded doors for security. To the right of the ambulance bay access doors is a decontamination room. Please do not bring any patients requiring decontamination directly into the ED. Inform nursing staff and utilize this room as needed. There is also an open workspace for all paramedics to complete paperwork just beside the ambulance bay entrance to the ED. This space is prox controlled. Everyone is welcome. Thank you for watching this brief overview of the new RUH ED. We are hopeful this will make your first experiences in our department easier to navigate. We welcome any feedback you may have and are looking forward to working with all paramedics in our new home.